पूछे कोई कि जिंदगी जीने का है क्या सलीका, मुस्कुराओ ये कहकर कि हमने जिंदगी से मुस्कुराना ही सीखा। मुस्कुराओ, मुस्कुराओ even if you have to walk miles and miles, because it's okay if your glass is half empty, you can always fill it with smiles. मुस्कुराओ. Thank you.
Key methods are important one. First one is the reduction method, second one is the condensation method, and the third one is the enzymatic method. In the reduction methods, examples are Follin Wu method and Nelson Somogoi method. In the condensation method, example is the orthotoluidine method, and in the enzymatic method, examples are hexokinase method and glucose oxidase peroxidase method. Among this reduction method and enzymatic method is more specific as compared to the reduction method because there are very few interfering substances are there and the reagents are more stable as compared to the reduction method. And this enzymatic methods measure the true glucose. And so these are the advantages of enzymatic method. While in the reduction method, estimation of glucose by the reduction method, there will be the various interfering substances will be there. Various interference by the various reducing substances like uric acid, bilirubin, vitamin C. So it will not measure the true glucose value. That is the one of the disadvantage of the reduction method. Another disadvantage of the reduction method, it is a multi-step approach. Fine. While the enzymatic method, there is a single step, but there is a single step only. Another disadvantage of reduction method is it doesn't measure the true glucose value. The only advantage of reduction method is they are cost effective as compared to the enzymatic method. But nowadays, the frequently used method for the glucose estimation is enzymatic method, and in the enzymatic method, examples are hexokinase method and DOD-POD method. And we will also discuss why hexokinase method is better as compared to the DOD-POD method. Estimation of blood glucose by glucose oxidase and peroxidase method. The blood is converted to gluconic acid and hydrogen peroxide by glucose oxidase, and the hydrogen peroxide is catalyzed by the peroxidase enzyme to the H2O and nascent oxygen. This 4-amino antipyrine, which is an oxygen acceptor, will accept this nascent oxygen, and in the presence of phenol, it will be converted to the pink color chromosome. And the intensity of this pink color will be directly proportional to the concentration of the glucose present in the solution. If it is a darker pink color, that means glucose present in the blood or in the solution is higher. And we have to measure the intensity of the color at 520 nanometer wavelength, and we have to compare it with that of standard treated similarly. So that is the principle of glucose oxidase method, which is asked frequently in the exam. Now reagents required for the glucose estimation by GOD-POD method. So the first one is the glucose reagent. In the glucose reagent, it is consists of glucose oxidase, peroxidase, 4-amino antipyrine, and phenol. Along with the glucose reagent, we also require glucose standard, and the value of the glucose standard is known, which is 100 milligram per deciliter. Now, procedure for the glucose estimation by GOD-POD method. So first, you have to take the 3 test tube and label them as blank, standard, and test, and then proceed as follow. So first, take the blank in the blank test tube, that is 10 microliter. Then take the standard glucose standard in the standard test tube 10 microliter, and then add unknown sample 10 microliter in the test tube. And after taking the blank, standard, and test, add 1 ml of glucose oxidase peroxidase reagent in all this 3 test tube. Mix thoroughly, incubate at 37 centigrade for 10 minutes. And after 10 minutes, you have to read the optical density on the colorimeter at 520 nanometer or Green filter. After taking the optical density, you have to feed the optical density in this formula, that is optical density of test minus optical density of blank divided by optical density of standard minus optical density of blank multiplied by concentration of standard. Concentration of standard is known, which is 100 milligram per deciliter. After feeding the optical density in this formula, you will get the blood glucose. Now, normal range of blood glucose. So there are the various normal ranges of the blood glucose are there. First one is the fasting blood glucose. The fasting blood glucose, the sample is collected after 10 to 12 hours after fasting. Then there is a postprandial blood glucose, PP2BS. The blood sample is collected after 2 hours taking the meal, and the random blood glucose. In the random blood glucose, blood sample is collected randomly. So the normal value for the fasting blood glucose is 70 to 100 milligram per deciliter. For the postprandial blood sugar, it is less than or equal to 140 milligram per deciliter, and for the random blood sugar, it is 80 to 140 milligram per deciliter. So these are the various normal ranges of the blood glucose. Now, interpretations of value. So first we will see the hyperglycemia, the reasons, available reasons for the hyperglycemia. So there are the physiological reasons and there are the pathological reasons. So the physiological reasons for the hyperglycemia are high carbohydrate diet, Emotional, distress, anger, and anxiety that also can lead to the hyperglycemia. And pregnancy. Pregnancy can also lead to the hyperglycemia. Now, common causes of hypoglycemia, that means reduced blood glucose concentration. The physiological are during starvation, after severe exercise. So these are the physiological reasons for the hypoglycemia. And see how to do the operational procedure for the plasma glucose. So for the estimation of plasma glucose, various requirements are: first, there are the 3 test tubes. Then you will also be needing various micropipettes along with the tips. So these are the volumetric pipettes. Fine. So this both are the volumetric pipettes, and these are the macro tips, and these are the micro tips. Now you have to see how to insert this tips into the tip holder of the pipettes. So this is the way you have to hold the tip into the tip holder. Fine. So now we will see first step for the estimation of plasma glucose is labeling of the test tube. Fine. So the first you have to label the test tube. First is the blank. Then you have to label standard. Second test tube, label it as a standard. And the third test tube, label it as a test. After the labeling part is over, now you have to take the 10 microliter of blank into the blank test tube. So in the blank we are taking the distilled water, so take the 10 microliter of it and add that 10 microliter of blank in the test tube. Make sure that it is in the bottom of the test tube. Then you have to take the 10 microliter of the standard. The concentration of the standard is it is 100 milligram per deciliter. So take the 10 microliter of the standard in the standard test tube. Fine, so this is the standard test tube. And then you have to take the 10 microliter of the test. The concentration of the test is unknown, we have to find it out. So take the 10 microliter of the 10 microliter of the test in the test tube. After the adding blank, standard and test, now you have to add 1000 microliter of GOD-POD reagent in all these 3 test tubes. So you have to take the 1000 microliter of the GOD-POD reagent, and first you have to add into the blank test tube. So this is the blank. After adding the reagent, mix it properly. Then again take 1000 microliter of the GOD-POD reagent. Add into the standard test tube and mix it properly. And again take the 1000 microliter of the GOD-POD reagent and mix it properly in the test tube. After mixing it, you have to keep all these 3 test tubes into the incubator for the 10 minutes. So this is the incubator. The temperature of the incubator is set at 37 degree. So you have to keep it for the 10 minutes. So this is after 10 minutes of incubation period. As you can see, there is a color change in the standard and there is a color change in the test. As the concentration is higher, the color will be the more darker. So as you can see in the test, color is more darker as compared to the standard. Now we will